Sepsis is a time-critical medical emergency that causes serious illness and death. You can help save lives by recognising sepsis early and starting treatment promptly. Anyone can get sepsis, but children, infants, the elderly, and other high-risk groups, including Aboriginal and Torres Strait Islanders people, are most at risk.
In New South Wales, we have sepsis pathways that will guide you to recognise and manage sepsis in adults, paediatrics, maternity and newborns. Asking the question, could it be sepsis, and using a sepsis pathway will save lives.
Things that should alert you to ask, could it be sepsis, and I should use the sepsis pathway are any abnormal vital signs or observations outside what's normal for the patient could be due to sepsis. There may not be a fever, and sometimes patients with sepsis only have an increased respiratory rate. Don't pass it off as anxiety or pain. Some patients present with an alteration in mental state or behaviour. Remember, patients with nausea, vomiting and diarrhoea don't always have gastroenteritis. Don't forget to check the lactate. A lactate of 2 or more should never be ignored or dismissed. A lactate of 4 or more is a mandatory rapid response call.
Parents and carers know their child best and may pick up serious illness before you identify any abnormal clinical features. If parents or carers are concerned that their child is getting sicker, you should be worried.
You should ask, could it be sepsis, and use the paediatric sepsis pathway when you're seeing a child who's got non-specific signs such as irritability, drowsiness or poor feeding, a child who's in pain, distressed or behaving in a way that cannot be explained or doesn't fit the clinical picture, or a child who's got persistent tachycardia. Infants and children with serious illness increase their cardiac output by increasing their heart rate.
Children can be harder to assess, so don't be afraid to escalate to a senior clinician. That's why we're here.
Older people are at a higher risk of sepsis, and sometimes it can be hard to spot. They can present with non-specific signs and symptoms and don't always have a temperature or an elevated white cell count. Think about sepsis when an older person comes into hospital with an acute decline in function, a delirium without an obvious precipitant, or a fall without an obvious cause. Any of these should prompt you to ask, could it be sepsis?
Sepsis is still a cause of serious illness and death for women in pregnancy and following birth. Asking, could it be sepsis, and following the maternal sepsis pathway is the most effective way to prevent this happening. The physiological changes seen with pregnancy can mask the early signs of sepsis and affect a woman's ability to respond to infection. These changes can also make a woman even more susceptible to rapid deterioration. When sepsis is suspected or confirmed after birth, both mother and baby must be assessed.
Remember, there are sepsis pathways for adults, paediatrics, maternity and newborns. The pathways align with the Between the Flags system and will help you recognise and manage sepsis effectively.
Parents, carers and families usually know their loved ones best. If they're concerned their loved one is getting sicker, or if you're concerned, take it seriously. Stop, think and reassess. Could it be sepsis?
Sepsis is a time-critical emergency and needs a team response. The most valuable lesson we have learnt is following a sepsis pathway and acting on concerns early improves patient outcomes.